Position, Dr. Gingrey.
Mr. Chairman, thank you very much, and I want to thank you and members on both sides of the aisle for extending us this courtesy to be guests today and indeed to ask some questions. Let me real quickly turn to Dr. Novak. Obamacare does not address the problems of most Americans who have very low expected health care expenditures. According to the Agency for Health Care Quality Research, and I think you talked about this in your testimony, the bottom 70% of health care users in this country, that's about 224 million Americans, spend only, I think you said 11% of the health care dollars, or about $290 billion out of $2.7 trillion. In your testimony, you stated that Obamacare harms these 224 million Americans that are very low utilized. Why?
Number one, costs are going up. That's number one. Number two is the creation of all of these new bureaucracies and boards and the effort to shove these people who are just occasional users of health care into very complicated medical home models that make it harder to get access to specialty care when that may be what they need just to get in and get out. That makes the system more difficult to navigate. It makes the process of going to the doctor a less pleasant experience.
Dr. Novak, thank you. Turning to Dr. Collier, Lieutenant Governor Collier, you talked about what you and what Governor Brownback have done in the state of Kansas in regard to the Medicaid program. So I want to focus in real quickly this question to you. You spoke about the off-ramp. I think you used that phrase, that off-ramp of getting people off of Medicaid into private insurance. You know, part of PAPACA, the Affordable Care Act, has this maintenance of effort requirement under Medicaid for at least the next 2 or 3 years before the expansion kicks in, the additional 20 million people. And as I understand that maintenance of effort, it would prevent you and Governor Brownback and Governor Deal of the state of Georgia and folks that are working on trying to solve their Medicaid problem in a state-based way, the crucibles of innovation, that you couldn't even look at your roles and determine if many people in Kansas who 2 years ago were eligible for Medicaid, but maybe today they're not. Indeed, maybe they're not even legal citizens, legal residents of this country, but more importantly, from the economic standpoint, they're not eligible. Isn't this a tremendous problem for you to get these folks onto that off-ramp, as you described?
Well, we want to give people the opportunity to get back into stable commercial insurance that they can control, that's very portable, that they can take with them. Maintenance of effort does decrease that. But part of the problem with the maintenance of effort is not just that people are in, it's being really interpreted in very broad ways. The previous governor asked for just a small increase in the premiums that were paid by certain CHIP members, and instead of a few dollars, there was just a few cents.
So essentially what you're saying is you've got handcuffs on you that prevent you from doing some of these things in an innovative way to make sure that the dollars get to the people that need them the most on the Medicaid program. Let me utilize, Mr. Chairman, the remaining portion of my time to talk to and ask questions of Dr. Armstrong. Dr. Armstrong, and thank you for wearing that white coat. That means a lot, believe me, to the weak physician members that are sitting up here asking you the questions. On page 78 of Public Law 111-148, otherwise known as PAPACA, Affordable Care Act, Obamacare, there's a section entitled Enhancing Patient Safety. Let me read you the section. Beginning on January the 1st, 2015, a qualified health plan, otherwise known as an insurance company, may contract with a health care provider only if they implement mechanisms to improve health care quality as defined by the Secretary, indeed by regulation. My concern is that nowhere in the many pages of Obamacare is the word quality defined. So I'm interested in the thoughts of the panelists. If Obamacare gives the Secretary of Health and Human Services the power to invalidate the private business contracts that providers need to stay in business, in other words, they have to be on the panel, What type of authority does that give the Secretary to direct how providers deliver care and practice medicine? Dr. Armstrong, in your testimony, you cite the U.S. Preventative Service Task Force and its findings that recommended against mammography screenings for women below the age of 50. I'm an OBGYN, 26 years in practice. I do not believe that such a recommendation is the kind of personalized medicine that my patients deserve. Each patient's different, and therefore I would probably not adhere to this bureaucratic directive from Secretary Sebelius or any other Secretary of Health and Human Services. I would listen to my specialty society, the American College of OBGYN. So tell me, real quickly, I know I'm a little out of time, tell me, Dr. Armstrong, could the Secretary of Health and Human Services literally drive me or any other practitioner out of business under the authority given to her to enhance patient safety?
Yes.
Thank you. And, Mr. Chairman, thank you for your indulgence, and I yield back.
Thank the gentleman from Florida. The chair will now recognize the gentleman from Michigan, the distinguished Dr. Benishek.